Dear colleagues, dear partners, hello, bonjour, grüezi. We at the Data Science Competence Center of the Swiss Federal Statistical Office are very happy to welcome you to our webinar series, Data Science and AI for Public Good. My name is Yara Abu Awad, and I'm a senior data scientist and group lead at the DSCC, and I will be your moderator today. We are thrilled to have Dr. Satchit Balsari as a speaker. Dr. Balsari is an emergency physician and faculty member across several Harvard schools, where he teaches on disasters and interdisciplinary approaches to complex societal challenges. He co-directs CrisisReady.io, a research response platform based at Harvard University and Direct Relief that collaborates with academic institutions, technology companies, and response agencies to embed data-driven decision-making into local disaster planning. Chief among his innovations are syndromic disease surveillance tools deployed at the world's largest mass gatherings. He is recipient of India's highest honor in medicine, the BC Roy Award, presented by the President of India. His talk today is entitled Crisis Ready: Data-Driven Decision-Making for Public Health Emergencies. We will take questions at the end of his talk, so please submit any questions you have using the Mentimeter link that you received with your invitation, or use the following code on mentimeter.com. So it's mentimeter.com. And the code is 495205. So without any further ado, Dr. Balsari, the floor is yours.
Thank you very much for that very generous introduction, which I suspect I may have sent you. But thank you. And thank you for inviting me here. I very much look forward to learning from all of you attending the webinar as well. I'm going to share my screen. Bear with me for a second. Yara, can you give me a thumbs up if you're seeing this properly? Excellent. Great. So a little introduction to where I'm coming from and what this work is about that I would like to share with all of you today. I work for CrisisReady along with a very large team. The principal colleagues here are interdisciplinary, from epidemiology, from public health, from medicine, from demography. CrisisReady is an initiative that straddles the Harvard Data Science Initiative, as well as Direct Relief, the humanitarian agency. We were organically formed first as the COVID-19 Mobility Data Network in early 2010, around a story which all of you will be very familiar with. So one of my co-directors, Professor Caroline Buckey, is an infectious disease epidemiologist, and she's one of the world's leading authorities on the use of human mobility data from cell phones in epidemic modeling. Come mid-March, late March 2020, when non-pharmaceutical interventions was all we had, the world, of course, responded by travel restrictions and, draconian lockdowns, travel bans. And one of the most powerful tools we thought we then had is to say, look, if we are going to restrict mobility and risk the kind of economic shutdowns we are, is it actually having any public health impact? So, of course, on one end of the spectrum, you needed to measure whether your R naught, a term that we've all now begun to forget, but that we were all very familiar with in 2020, whether it was actually impacting the R naught. And that, of course, depended on a host of downstream capacities locally in terms of being able to trace and test and have the tests and have the data from these tests and whatnot. But on the other end of the spectrum was to actually know how to count whether these policies were making a difference, right? Just by saying that there was a lockdown or travel restriction, it didn't mean that actually there was. And the only definitive way to measure that was to see whether people were moving or not, and it was 2020, and therefore human mobility data lent itself to this exercise, as several of you, from my understanding, are involved in. And what we began to find is that there was an acceleration in the availability of these data. If you remember, the years leading up to this, there was two ways in which you could get human mobility data from cell phones. You could either get it from telcos, right, from the telephone companies themselves, or you could get it from a bunch of apps that would collect GPS traces, anonymize, and aggregate that information. The data from cell phone companies always entails, to date, many years of negotiations, right? You're building relationships. They have to trust that you, the academic institution, or sometimes a government agency, but not always, can be trusted with the data. In the early years, you sort of co-designed the aggregation and the anonymization process, and eventually telcos would want to do that in-house before they ship this data out to you. And that negotiation took a long time in relationship and trust building. Programs like Meta, but then Facebook's Data for Good, had started making anonymized aggregated data sets more readily available, but you still had to apply for it. There wasn't sort of a website you could go and just download it from. There were some barriers and checks and balances in place, right? But in 2020, a lot of these data started becoming a little bit more readily available, and the threshold for the availability of these data started to fall. You also had companies that started putting the analysis from these data out. So we had SafeGraph, for example, and Unicast in particular from SafeGraph that would publish these scoreboards. City X gets an A grade for social distancing, and City Y gets, a C grade. And this is when interpretation became a challenge. Is City A that is getting an A grade, how are we actually measuring mobility? Is it a radius of gyration? Is it the distances that people travel? Because you could see that a suburb in the United States that was full of elderly people that were, living in houses that were distant, that sat in their cars, drove long distances to go to pharmacies to pick up their medications in the special hours that were arranged for the elderly at 7 in the morning, where they would not come in contact with anyone, and they would come back, would be traveling miles. And the hipster in Williamsburg in New York, who would only get down from his apartment but would go to a bunch of bars, would only travel a few meters. And it is likely that his mobility would be counted as acceptable, while grandma's mobility may not, right? And sort of who decides what these metrics were going to be? How do you standardize these across? And so in those early years, in those early months, we basically organically blossomed into a network of about 70 scientists from around the world, from different disciplines, policymakers, that got on a phone call with government agencies every evening around the world, city, state, national governments, because everyone wanted to know what to do with these mobility data. Do I lock down? Do I not? Do I travel restrict? Do I not? Is this good? Is this bad? And it was unclear what all these analyses meant. What was the action point? And you quickly realized that there were challenges with procuring the data. There were challenges in figuring out the capacity that you needed and the right kind of expertise. You had all kinds of people, as we know, drawing SER models, right? Everybody was an expert in flattening the curve, and everyone was trying to do infectious disease modeling. You could barely get that part right, but then to have sort of the uncertainty around mobility data layered onto it, right? So there was a methods issue that was a challenge. And we found that the only way to sustain that was a federated network of folks that had the capacity, who would then work with local scientists and local teams. And there was a translational piece where even if you had the best analysis and you went to a government agency, they were way too overwhelmed to either receive your information or did not have the embedded capacity to do anything with it. Fast forward a year, we realized that the issues that we were dealing with and sort of this framework that was emerging from what we were doing, a data, methods, and a translational readiness framework lent itself to many kinds of public health emergencies and natural disasters, and not just epidemics. So from that, we transitioned to CrisisReady, the genesis of which was in the pandemic, but we decided to sort of focus on a host of other disasters. A little bit of our own team biases come into this, of course. I am an emergency physician. And what I found in recent years, in the last 10, 15 years, when you look at disasters, even in developed countries, is that the morbidity and mortality is not clustered around the acute event. Our built environment is reasonably strong, and I say this, cognizant of what is happening in Florida as I speak, but it is still relatively small. So of course there is an acute attack, and people lose lives or may get injured. But it is because of all the infrastructure disruption that follows, loss of transport, electricity, cell phone, water, that you see a very long tail of morbidity and mortality. Some of our work in Puerto Rico after Hurricane Maria showed that the death toll was not 59, as the government had said, but was, orders of magnitude more in the 4,000s. So that's sort of the context with which we began to look at our data readiness, methods readiness, translational readiness framework. There are a few issues I want to talk about, time permitting. We may or may not be able to get through all of these. But I want to share with you how we are thinking through the challenges we see with the application of human mobility data, but also a lot of these cell phone-based technologies in public health, including contact tracing apps that we've all had to deal with. I'll pause here for a second as we transition to sort of data, methods, and translational readiness. This framework isn't something that our team internally developed. We led a consultation process in 2021 through several months, the spring and summer, inviting over 40 experts from technology companies, from cell phone companies, from law and policy, from public health, from government, and from academia to try and map whether people's concerns about the application of mobility data or the potential that they saw actually overlapped, or were these different communities, all important stakeholders, working in different directions. Our report, which is available on our website, CrisisReady.io, it's called the white paper from the Radcliffe Conference, summarizes the key issues that were gleaned from this exercise and through an extensive literature review around data methods and translational readiness. One of the key issues, of course, was the provision of access. Who decides that this data should be available? Europe has GDPR. The United States does not have good rules around this. California has the data protection regulation. Most of the rest of the US doesn't. Most of the rest of the world doesn't. And in the absence of regulation, whether or not the decision to use human mobility data for public good is then often left to the largesse of corporations. And they have tried to self-regulate this, right? So everyone has a data for good program. There is Google AI for public good. There is, Facebook now, Meta's data for good program. Quebec has a data for good program. And they decide when certain data can be toggled on and off, when and what kind of data should be released, what kind of geographic contours around the data sets that they are going to release, and so on. The mechanics of the access, and I have picked this slide because it speaks to some of the themes that we have raised here. This is the Google platform, right? Google had community mobility reports. Very interesting. One of the largest and smartest data brokers in the world did not push out easy APIs. You literally have to go onto their websites, select your country, and if you look at the slide, on the right-hand side, it says download PDF. So you would have to scrape this information if you wanted it, right? And then there is a sentence under community mobility reports, which may be very small for you to read, but it essentially says that these reports, actually, I'm sorry, that sentence doesn't show up here, but it essentially says that these reports will come to an end in October 2020, right? Google decides when the mobility data should come to an end. And of course, there must be a consultative process within the company, but it may be safe to assume that Aruba, for example, that shows up here on this list, may not have much of a say in deciding, first of all, whether the mobility data should be available and whether they should then be taken down. The mechanics of access, another point is, of course, there are advances where Facebook has one of the lower barriers to access, and they have differentially private data that you can apply for, and if you fall within their eligibility criteria, they will give you the data. They usually, we have noticed, prefer to work with academic partners than directly with government. So there's often a research intermediary that works with the Meta Data for Good program and governments, and they have some of the more responsive Data for Good teams that will work with you when we start talking about the utility of this data, which brings me to this point. You are now looking at movement data from wildfire in California. Facebook changed the way it calculated and presented and aggregated, formatted and shared its mobility data a few months ago. So all the programs that you may have written or built would sort of have to be redone. Often there is very little local capacity to even do this, and this shift, which came relatively suddenly, required a fair amount of engineering. What we found is that the resolution of the tile size that they were using to protect privacy was grossly inadequate for it to be useful in rural areas in California, because if the threshold, say, was if there are less than 10 users in so-and-so mileage, then we won't count them. You just ended up with lots of empty plots. And it would look like either everyone had left or nobody lived there. And we've been working with this team for many years, and so had a relationship where one of our principal researchers, Andrew Schroeder, who's vice president at Direct Relief and co-director at CrisisReady, and technically manages the data himself, very familiar with what was needed on the ground, because he has 1 foot in Direct Relief, or actually both feet in Direct Relief, is an expert in the field for many, many years, and has a good relationship with the Meta team, where they trusted that feedback from the CrisisReady team and Andrew Schroeder's team, that said that the utility of these data were severely compromised at this resolution, allowed Meta to consider, for this instance, to readjust their tile resolution. And so then we had a second iteration of reports that look a little bit different, and I apologize for the size on the screen, but the right-hand bottom screen, if you squint and look in and press your nose to the monitor, you see a whole bunch of squares that show up, and the red and the blue squares indicate population mobility. The slide speaks for itself a little bit, right? Where one can think that point of interest data right, which is being able to identify locations of places or even groups of people going to these places could be useful in many situations, Red Cross shelters during a hurricane, or even, reproductive clinics, because women would be able to find them easily. But of course, context matters. And the ability to identify Planned Parenthood clinics in the current political climate in the United States became extremely dangerous for the clinics and for the women. And you can see this with gay clubs, you can see this with religious minorities in other countries, right? And so this balance between resolution and utility involves multiple stakeholders, most importantly, the community that often has the least input into this conversation around the balance. I think if you ask researchers and epidemiologists, we clearly need, the more data, the better, the more granular, the better. The question is, what is that threshold where the incremental value of getting more granularity is now compromised by the risk that you are posing to individuals and groups that may have not had a say in this? And is it okay to change that threshold in public health emergencies? And who decides, right? And that's sort of where our contact tracing apps come in, where of course you had the very decentralized ones, like the Swiss app, but then also very centralized ones like the one in India, where you had location data on individuals. And is public health emergency a license to therefore break that class? These conversations around the pandemic then lent themselves to saying, well, what about consent? Can you check consent? There are various arguments about consent. Some will say that, look, it comes from a completely different world, which is the medical world, where you're talking about a real human being and their body, and even there we do it so poorly. So this is an interesting paper about phase 3 COVID-19 vaccine trials, which showed that the consent form was really unacceptable and that people did not understand what they were signing up to, right? So the medical community, after decades of doing this, hasn't gotten it right. We've all read papers about and experienced ourselves the completely ridiculous consent forms that we sign on our little apps, where you're supposed to go through 100 pages of information on your little screen. Others say that this is just the wrong model itself. Why are you taking something from the medical community and applying it to what is a hypothetical figure? This is not a real human being. It is a probabilistic individual. You are triangulating data from folks, assuming this is someone. In most cases, you're aggregating, if not aggregating and anonymizing the data. Does consent even apply? Are you thwarting medical science, scientific advancement by applying this consent framework to these probabilistic individuals and groups, where it's not the appropriate way to look at consent? Can you instead use technical tools instead of consent, right? And so many will say that consent is not scalable. The GovLab in New York University says that we should negotiate access with communities. Can we actually have data assemblies? Go to Aruba and say, the next time there is a pandemic, are you willing to consent the use of your data for a finite amount of time? Now, we all understand the slippery slope that this takes various governments and communities and societies, and the reluctance that many people have to start opening that Pandora's box. That being said, there are several people on this conference that are used to multiple referendums in their community where people have a voice and a choice in these kinds of decisions. Can they be scaled in large populations like India and China, or even in the United States? Should there be exceptions? Who decides? And who decides who decides? So others say that this sounds very good, but is not scalable. And maybe it is what we need to do initially, but there might be technological solutions around consent. And can we instead start thinking about things like differential privacy? And there are some that vociferously defend differential privacy over sort of consent-driven models or technological solutions, right? Saying that we've tried this with the US Census. This is an evolving solution. The OpenDP tools, the suite of tools that are developed by Microsoft and Harvard, for example, may lend themselves to being a good solution here. Looping back to the previous point we talked about, yes, anonymization and aggregation and differential privacy now all are good, but how much noise are you introducing to still remain statistically relevant? And at what point do those parameters change? How do you change the noise? And very quickly, as I'm speaking, I think we all realize this gets very methodologically complex. And for each situation, for each epidemiological application of public health emergency, you now suddenly need a lot of in-house capacity to think through these issues in the technology company, in the government, in academia as well. And that brings us to methods readiness. These were just the issues with procuring data and negotiating access to data. How do you now start understanding the issues with where these data are coming from? Whose cell phones are we counting? At best, when you are able to negotiate access to cell phone data, it's usually just one telecom company. Rarely in a country with all the competing telcos be willing to share this data. Most governments prohibit telcos from sharing this data, even with researchers. Some governments may collaborate with the telcos to use these data. And this is very different in Asia and the US, in Europe. Not only is, who's being represented by that telco company, are there a lot of elderly people? Are there a lot of military people that sign up to a particular kind of plan with a particular kind of company? But if you start looking at GPS traces from your social media apps, which apps are being counted? And finally, which people are being counted that have smartphone on there, that own smartphones? And suddenly we find that some of the most vulnerable people in the kinds of public health emergencies that we are worried about may not have smartphones, may not have the latest smartphones, certainly for contact tracing did not have BLE2 activated devices. They may not be using the apps from which the data are being aggregated, and so on and so forth. And how do you start beginning to unravel all of this? Is harm real or is it perceived? When South Korea signed up for the contact tracing app, did they have a choice? And even if they did not have a choice, did they have a relationship with their government that made them okay with this breach of privacy? Would it be different in society in Northern Europe? Would it be different in South Asia? Yara and I were just talking before we went online. And, when you think about contact tracing apps, there were a whole bunch of them that were very, very, very privacy preserving. And those were probably not very epidemiologically effective because of how they were designed and, they didn't log location data, etc. Was the harm that they would have created in those societies real? While the awareness for harm was right, were those the governments that were most likely to harm their citizens? As opposed to other governments where the apps were not very privacy preserving, were probably epidemiologically more sound because they did know everything about everyone, but probably didn't have uptake where the maths didn't work out. You just did not have enough people using the app because there wasn't that trust in government that would allow you to share these data, right? So I think harm has to be quantified. There is obviously on one end with the privacy advocates, a lot of concern about potential for harm. And then you have to think through whether this is real harm or likely harm and sort of where is that balance. And then on the other hand, of course, you have this overreach that a lot of governments engaged in collecting the data. And depending on which stakeholder you are, our role in that ecosystem. Standardization, of course, gives every academic on this call, every scientist on this call, an ulcer, right? The way Google will aggregate and anonymize their data will have nothing to do with the way Cubic does it or the way Meta does it. And most of them will not tell you what they are doing or will not give you information about their users, right? So you often don't have denominators. So when I see that a lot of people moved from one town to the other, was that actually representative of the population, or is that mostly a geriatric population that could not move, but the 15, 20-year-olds that were there all had Facebook, and so they all show up as having moved because they could move, right? So how do you begin to sort of map that data to any other mobility data? We try to map healthcare facility data in California, and depending on which data set from which government agency you try to use, there is very little correlation between how a healthcare facility is defined. So now imagine trying to combine all these various completely different data sets and standardize them to make actual sense of, replicability, validity, reproducibility across jurisdictions, across countries, across populations. There is work being done by scientists around the world to start proposing some frameworks where mobility data and epidemiological data can be compared so that we can do some modeling, we can figure out sort of what these prediction tools need to look like. I will just pause here before getting into translational readiness by saying that what I was trying to do here, because many of you are very familiar with these topics and living this in your daily work life, is signal the complexity and therefore the impossibility of reproducing this globally, especially in the populations that need it the most. We just do not have the means to automate this. There is still so much of hands-on work that has to be done in this methods readiness piece, and it should ideally be done before a disaster. So negotiate the data access a year or two in advance, work on the methods. Even if the spigot for the data are turned off, that's okay. Know what will happen when the data start pouring in, right? So you have to negotiate access under certain emergency conditions. And when the data come in, cannot go around figuring out the methods. We have to have done it already so that they can be deployed in real time. Local context is completely the crux of how we need to work. Because the nuances of what the data means is completely lost, as we all understand. While Manhattan in New York City, of course, socially distanced because it was the latte and laptop crowd, and they were wealthy enough to be able to stay at home. When you see that the Bronx is not socially distancing, the response cannot be a police force going in, but it needs to be an understanding that here is a population that had to operate the Ubers and the DoorDashes to make sure that Manhattan was able to stay at home. Someone else had to do the running around so that community X could stay safe. Community Y would have loved to had they had the socioeconomic means to. And so the correct public health response then would have been the economic security you needed to provide during an emergency, right? And so sort of local context becomes very important. At CrisisReady, we do this by going to the field. Here's a photograph of a conference in Budapest that happened in the weeks following the efflux of refugees from Ukraine. And so we had mayors of all the neighboring cities and especially large presence from Poland trying to figure out what kind of information would be most useful. So we had, UN representatives, local governments identifying the kind of data that they needed to see how a federated group of scientists that we support through regional hubs at CrisisReady can continue to work 24/7 to provide the analysis that the locals identified they needed. And that's where the global expertise comes in. This is a snapshot of who we were 2 years ago. It's a completely different set of players now. But even the COVID-19 Mobility Data Network, as you see, is a smattering of folks that had the expertise to donate. It's beyond the scope of this call to talk about just the incentives, who is doing this work right now and whether they're academic careers or their, foundation, philanthropic, humanitarian agency roles actually support this kind of work. Another wonderful idea proposed by the GovLab is data bilingual. So what they have proposed is we need to start doing is have these professionals that understand both the social science and public health, but also understand data science and machine learning. And they can straddle these spaces, ideally in public response agencies. So they understand what to ask for and what to negotiate or influence policy to help regulate access to these data. I would love to share with you a project that brings together a whole bunch of themes that I raised. I'll pause here for a second, reflecting on what we talked about. I gave you an example of a group that came together in response to the use of mobility data in the COVID pandemic and said, look, there are many challenges. The challenges around data readiness, around methods readiness, around translation readiness. The data piece largely has to do with who controls these data, how do you get access to this data, but how do you influence what kind of data are being pushed out? At what resolution, at what frequency, when, from which population, right? And what do you need to do that? Do you just build happy relationships? Do you need to bring in regulation? Does there need to be local, international work done around opening up access to this data? Do you pay for this data? Do communities have a right to this data, right? The methods readiness piece is likely one that you're all very familiar with, which is just the struggle to make sense out of these novel data streams as more and more new data streams can be layered onto this, right? In California, we can do remote sensing, put smoke plumes on top of the fire images. And the translation readiness, we can do all this fancy work, but finally, who's listening? And do they have either the appetite or the capacity to absorb this data? I'm going to stop sharing my screen for a second and restart. So what we now have here are some of the products that I will share with you are online data visualization tools where we've had to walk this journey of data methods and translational readiness. Whole string of data around vulnerability of populations. So more than 65, those with durable medical equipment. I mean, you can go on and define what kind of population of interest you have, right? And we were interested in saying, look, when there are fires and hurricanes in the United States, there is damage to buildings, but healthcare capacity is compromised, power outages force people to move, right? So that's how we identify vulnerability. Movement, of course, was based on, cubic or Facebook data, which is, these blue and red squares that you'll start showing up that show an efflux of people as the hurricane moves in. I'll try and zoom in to give you a sense of sort of what this looks like. But now when you look at this dashboard, based on the last 40 minutes of my monologue, we quickly recognize sort of the years of work that then goes into just being able to say, okay, people are now moving as this hurricane comes closer. We then are layering infrastructure data where you're looking to see, what hospitals, what healthcare facilities are there, whether they have bed capacity data available, etc. We do not expect folks to, I think there are different kinds of users, and this is a translational piece that I want to illustrate. I think it still needs an intermediary, a bilingual of sort that understands what the public health questions are and then how to use these data visualization tools, what feedback to give the scientists that are generating these data visualization tools. And so we have a generate report option, which may not show up as I try to screen share, where PDFs are created, right? And then there is an actual report that you can walk over to the decision maker's office and say, here are the numbers from today. Can you, right? So our reports look like that, right? And they can be customized to what that incident commander wants to know. Here are the cities that are evacuating, here are the cities where people are moving, here are the healthcare facilities that are off, that are on, power outages, and so on, towns. And we find that every day we end up applying sort of this data methods translation readiness framework, where in spite of all the data and methods readiness, when there is a new disaster, there is a new hurricane, there are no APIs still for us to just populate the tool with all this kind of information. It still takes a couple of days to rev up. Something breaks down, someone's not available, there is a human in the loop. You have to knock on some company's door and say, hey, will you start collecting this data? A lot of the data is compared to the previous days, so you want to make sure that you actually have a real baseline, and then you didn't start too late where your baseline is post-disaster, and so it would not capture the full extent of, who had moved and who had not, and on and on and on. Right? So this is an extraordinarily and enthralling and enjoyable piece of work that we think is really critical to how we start thinking about public health emergencies. We have a range of sort of webinars and talks and publications that are available on our CrisisReady website that we would welcome your engagement with. We'd love to hear from what is happening in Europe and sort of how you are all thinking about this given GDPR and some of the restrictions around the use of these data. A quick thank you before we open up the chat for questions to this team and many others that these individuals represent from around the world that have helped us think through the framework that I presented to you today. Thank you kindly for listening.
Dr. Balsari, thank you again for your presentation. That was very interesting. I just want to remind everyone that to submit questions, you can go to menti.com, so MENTI, and use the code 495205. 495205, just to repeat that. I do also want to emphasize sort of what you said, that your website, CrisisReady.io, there's so many publications on there that are very, very helpful. And you sort of get into things like, for example, understanding how human mobility shapes TB epidemics and malaria and so on and so forth. Just going back to something we had talked about before this webinar started, I had told you about a presentation I'd attended where someone did have mobility data, but then once they had it, they didn't know what to do with it. And so I kind of wanted to talk about, let's say you have an ideal situation where you have that API and you can just update, people's mobility information and everything is in place. Let's say something like COVID happens again, which nobody wants, but let's say something like that happens again. How would you envision the role of mobility data in a public health emergency like that,
Yeah.
for example?
That's a very interesting question, because as much as we want to say make the data differentially private and release them, I think we have to be cognizant of real world context. Anyone who could code was making SEIR models during the pandemic, and they were all wrong.
And just, oh, sorry, just for our audience members who don't know, would you mind explaining what SER is?
Yeah, the prediction models, the curve that everyone saw, right? Where COVID peaks and it goes down and then it bumps a little. And that one viral slide that went out in early 2020s that said we have to flatten the curve, and you don't want all these people to fall sick at the same time. You want them to fall sick over a long time. And that's not what happened, right? And yet there were governments and computer scientists falling over each other without any training in infectious disease epi modeling, right? To make these, and there were governments that were taking draconian measures on people's ability, on their fundamental right to move, right? And yes, there is an element of Monday morning quarterbacking here where we can look back and say, we didn't know this then, but actually we did a lot of it. Do you actually lock down 1/6 of humanity as India did on 24-hour notice? Without preparing people of whom millions were daily wage workers, because you could now code and make a graph, right? So if we start pushing out these mobility data without a sense of responsibility, the question that'll be hard to solve is then who's responsible? The technology companies will say, you were all demanding that you want this data, so we're not selling it. It's differentially private. It is yours. And then folks that don't necessarily know how to use it are then likely to misuse it, right? And the counterfactual is, of course, important as well, which is, look, the more it is available, the more scientists have access to this data, and this should not be all locked up in elite institutions. That's not fair either. I didn't answer your question.
You did a little bit. I was sort of thinking about the other thing we discussed earlier about paying for data, paying for mobility data or not. And it made me think about what you had said earlier about these tech giants like Meta, who are releasing mobility data. Just from my own understanding, is that, if someone has the Facebook app installed on their phone, is that what would, okay. Yeah.
No, you have to turn.
No, oh.
A few months ago, it was folks that had Facebook on their phone, not on their PC, and had turned on their location services.
Oh, okay.
But they have changed how they're collecting it. It's not entirely clear. So the new data set is actually a lot richer than it used to be before. So there was definitely a representativeness challenge with the earlier interpretation during COVID. The current includes more information. It is not clear what information that is. And from what we understand, it does not include WhatsApp.
Okay. And I was just thinking about the contrast between that and, for example, mobile network operator data, which sort of tells you, this person was in the vicinity of this cell phone tower,
Yeah.
And it only captures information if somebody made a call or sent a text, or and you sort of have the challenge of, if someone is out in a very rural area, that cell phone tower area is huge, whereas if they're in an urban area, it's much smaller. And so the resolution will change drastically depending on where that person is located. It's just sort of thinking about, does Facebook also have those challenges? Do you know if you would use data from the Facebook app, for example, or
I think granularity absolutely becomes a challenge, because, the example that I brought up with my slides, if you decide that you are going to only allow a certain resolution so that, you can't hone in on people's houses, and, you make it impossible for folks to say, oh, that family moved, right? So you want to make it a little bit more diffuse, but that diffusion may not be enough in a rural area where it might need to be even more encompassing. But if you use a rural window on an urban society, on an urban community, you'll capture thousands of people and it might be meaningless, right? So absolutely, I think Meta is also facing this. And the question is, whose job is it to regulate this? I mean, they're all doing this as a CSR activity. They're saying this is philanthropic. So should they be putting more and more resources to customize granularity and utility and, risking privacy breaches given, what they have already encountered over the last 10 years? Should the governments be mandating it? Who pays for this? And so often, and I think this is where you were going, the technology companies say, yes, we'll do it, but you bear the costs of this additional work that we have to put in. We're not really charging you for the data, but we're charging you for the effort to process the data, because this is not a business use case for us at all.
Yeah. And then, we sort of come back to these contact tracing apps where these big tech companies mandated to governments that like you can have one app or two apps, like they sort of restricted what governments could do, which is interesting. But also, when you were talking about the lack of utility of these apps that were very privacy preserving, it feels like we know that technology has a lot of potential, but then when it comes to the actual application, we start to understand the limitations of what we can do with the technology. And I'm sort of wondering, can you foresee any limitations in the future with mobility data? I mean, even if we have, this perfect, and maybe it's hard to envision what that would be, right? Because we haven't done it yet. But yeah, what would we, it seems to have a lot of potential, but maybe all the things we're imagining may not be doable. Is that very negative? Maybe it is. I don't know.
No, I think we've made a lot of advances in just the last several years, right? Like, think about, smartphones have not been around for more than just a decade, and here we are, predicting population mobility in disasters in near real time around the world. So I think there will be a lot more of this. I think those of us that are facilitating the application of these data need to constantly strike that balance between, what's harmful, what's useful, what's really useful and what's really harmful, because there's a lot of sort of talk about utility as well, but are you actually doing anything with it? And if not, can governments be told to stop collecting X, Y, or Z data, right? Because in sort of the guise of public health emergency, we're collecting these data. I think I would conclude that thought by saying that trust is a public health desideratum, right? Without sort of a foundation of trust in peacetime, you cannot expect populations to then suddenly want to trust the government in emergencies. And so it is how the state or corporations behave in normal times that will sort of regulate not only the relationship between the corporations and the state, but also society and corporations and state when the stressors unleash themselves. And I think we often sort of forget that and think that within an emergency, everyone will be on their best behavior. And populations don't do that. We saw this with vaccination. We saw this with uptake of apps. People are not willing to trust unless trust has been demonstrated.
Yes, so a lot of people did not download the contact tracing apps because they were worried. And you say that government behavior in peacetime or non-crisis time affects how people will behave during a crisis. Do you have any best practices that maybe governments should? How can governments build that trust in non-crisis mode? Is it communication? Is it campaigns? Is it a legal framework?
Well, I think regulation certainly plays a role. A legal framework is important. GDPR was, a lot of people on this call may disagree. It was well intentioned, right? It signaled that we need to protect people. I think now the argument is, of course, that there are a lot of externalities which are preventing the advancement of X, Y, or Z. I think this complete absence of regulation in this space is not surprising. Often technologies come first and the regulations follow. But this unregulated space that we are in right now seems a little uncomfortable for societies, given where the governments have lurched around the world. I think this is not the moment in time. There may have been, and there may be, or there will be one in the future, where the relationship between the state and society would be different. But here and now, in the world in 2022, I don't think people are ready to trust the state as much as they did a few years ago.
That's fair. I'm aware that we have 4 minutes to go. Is there anything that you wanted to conclude with, or anything else that you wanted to add before our time here is up?
I'm very excited about where we will go as a field with this. We haven't given sort of the broad banner in which this webinar is organized. Machine learning and AI will add so many layers of this, right? What you want to be able to do to help people is to say that if a hurricane is moving in a certain direction, can my simulation models help me identify where the vulnerable are likely to be and where I'm likely to see hospital surges, right? The way we prepare for emergencies in most healthcare systems around the world today is by preparing for mass casualty incidents. 100 people are going to show up to my hospital. How do I quickly triage them? That's not what happens. Thousands of people lose power, and they show up to hospitals to, cool their medications or to get dialysis, or they go to shelters and they need their durable medical equipment to be powered. And the data we need to predict who all these people are and where they can and should go to be removed from harm's way all exist. But they are not available to either the communities or to the public health response agencies. And I think what we will do, and we will see, is advances towards saying, can these data be more accessible and better applied for the good of our citizens?
That's a really great vision for how this data can be used. I'm really glad you ended on that. Well, I'd like to thank you again for joining us. It's been really informative. And again, I want to encourage people to go to the CrisisReady.io website, because there are a lot of publications on there that sort of highlight the expertise that your group has around the subject. And I do hope that we get to communicate again in the future to maybe share knowledge and discuss more around this topic, which is very, very interesting.
Thank you for this
invitation. Thank you
very
again,
much.
Dr. Balsari. Thank you.